Doctor, medical examiners, morticians of Reddit. What is the weirdest anomaly you've ever found in a body? A mummified photus. I was working in Africa and the usually very stoic Congolese surgeons called me into theatre, gagging. The patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long dead mummified photus which, as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue, and over the years it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a fit memory. When my mom was a mortician, I would hang out in the mortuary watching TV. Her boss showed me a guy who had retained water and drowned. His balls were the size of a grapefruit. Not the most pleasant thing to see at age 15. When you poked him, he moved like a waterbed. Guy came in for an outpatient MRI of his cervical spine. On the form where it asks if he ever had any metal in his body, specifically asks if any injured by a metal object. He selected no. Same with a verbal question I. Also, we do a keyword search in the patient's hard chart for the term foreign body in case it's documented. Nothing came up. He lays down, and I start taking images while talking to him through the speaker. During one of the image sets, he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic. So I stop the machine and get him out. Immediately, he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the machine. I call overhead for emergency room staff to come down and security as he's flailing, continues screaming and running into the wall before we restrained him. The staff rush down, and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in, scared out of his mind and hallucinating. Security restrains him, and he's taken down to get an X-ray of his skull. There was a BB in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department, he kept trying to escape, and was very fast. While unrestrained, he got up, somehow convinced the guard he was a better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour, nobody could find him, until a nurse looked into a large storage closet. Poor guy was found in a pool of blood. He crashed into a large mirror that was leaning on the wall and had severe lacerations of his neck, face and arms. Efforts were made to transfuse him, but it was too late. Still haunts me how a simple BB from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. Weirdest thing was in a woman's intestine. A dead mouse. Tiny little thing. Obviously never got the chance to ask how the mouse got there, as this was post-mortem. Definitely unexpected, though. I'm a funeral director. I haven't seen anything too anatomically weird. But I did have an innocent-seeming old man with a tattoo on his shaft. Also, we had an obese woman, and when we were embalming bathing her, a sugar packet fell out of a fat roll. Just one of those little pink ones. It seemed like it had been in there for a while. In my anatomy lab, my group's cadaver had died from systemic complications of stage 4 lung cancer, and when we got to the lungs, they were too rock-hard. Necrotic blackened masses that looked nothing like the other cadaver's pink and spongy lungs. My anatomy proof took one lung out and wrung it, resulting in this putrid black goo flowing out of the lung. As he was draining the lung, he mentioned in an Indian accent, This is what happens when you smoke." Here's another weird one. 3 golf balls in a man's stomach. His cause of death was lung cancer. Still trying to figure out how he ate golf balls. How long they were in there, considering he was on life support for 2 weeks before he died. A real grub inside a tooth. An old patient came to us with a long-term and several pain in her tooth. The doctor extracted the tooth and put it into a tray. After 1 minute, we saw a grub crawling out from the tooth. This woman had lived with it for at least 6 months. During a class in university, we had a lecture on a nationally renowned entomologist. Talked about CI-type stuff bugs in cadavers to localize time of death. She also talked about symbiotic relationships that bugs can develop with humans, using maggots to eat dead tissue in burn victims. But then she finished the lecture talking about this guy, a long-time coke user. Turned out he was so tonked out most of the time that a large number of maggots had taken up residence in his gums between his teeth and were actually keeping his teeth clean for him. The last slide in the lecture PowerPoint was a headshot of this dude with a big grin on his face, and you can just see little maggot heads poking out between his pearly whites. I worked in medicine as an X-ray tech medical assistant. One day we had a patient come in complaining of a stomach ache. Considering the time of the year, it wasn't an abnormal complaint to have come in our family practice. So we run him through the normal test urinalysis and an abdominal X-ray QB for those medically inclined. Well, he was a shorter fella, so I had a lot of room on the film. This kind of X-ray is one large shot centered on your belly button. It's mostly used to see how full of shit you are. I went to the dark room to process his film when something weird could be seen near his butt. There was definitely a lot of poop backed up, but I couldn't tell what was causing the blockage. I showed the doc the film and she busted out laughing. The doctor I worked with was usually stone-faced and serious about these kinds of things, so it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement, I almost missed what he said. You see, this 40-year-old man has diarrhea the week before and decided to shove a tampon up his butt to stop it. He tried to take it out, but the string got caught, and then he simply forgot about it. We had to remove it. It was disgusting, and I never did another procedure ever again. Heard a story from a urologist when I was in medical school about a guy who came in for a visectomy. During the procedure, the urologist has trouble finding the vas deferens. So he orders a few tests. Turns out the guy has bilateral congenital absence of the vas deferens core. But the guy had 3 kids. I was a combat medic in the army. Not super uncommon, about 1 in 10,000 people have it. But I had a buddy with situs inversus. All of his major internal organs were reversed heart on the right side instead of the left, for example. As soon as he got to the unit, it was the first thing he told me. Wanted to make sure if he got hurt, I wasn't curious as to why he had no heart, I guess. Had to look up the name and how uncommon it is, because it's been a few years since I got out, and he's literally the only person I've ever met like that. I was honestly surprised at how common it actually is. I figured it'd be more rare. Emergency nurse. Man comes in after a car accident. We do a brain scan for safety and find a 3-inch nail embedded in his brain. Ask man about it. He says he has no idea. Admits he was once shot with a nail gun, but had no idea a nail had been lodged in his head. Had been there for well over 4 years. Originally said 6-inch, meant 3. Had a kid, anus imperforate, not that uncommon. Basically, his intestines ended in a blind pouch. What was odd, though, is that his genitals were rotated. When you took off his diaper, the scrotum sat on top. The penis was under it, pointing back. Emergency room physician. I think I've seen almost everything. Really? It's like anything anyone can think that is messed up. They have come to see me. Emergency room welded cock ring on for a week, causing guy to lose his junk. Fingernail polish remover bottle in an 85-year-old man's ass that ended up causing him to get a colostomy. Multiple small vibrators on and active in a lady that said she couldn't reach it. Even a terrible case where I found a big-ass square 6-volt battery in a woman's vagina. She came in because she thought her pimp had put an oil can in her because black liquid was coming out. But turns out the moisture caused the battery to make connection and charred the inside of her to crisp. I'm a carer for the elderly at a hospital. A nurse asked me to help her insert a catheter into a lady with dementia. But when we propped her legs open, there was a horrific smell, and we could see something dark in the vaginal cavity. It was a teddy bear. We think it was there a while. Not me, but my boyfriend's mom is a doctor for people with special needs. One of her patients, an older man with Down syndrome, OCA diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly one afternoon my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty. that this man had finally been able to go to the toilet, and amongst some stool was a blue latex glove. Over the following days, he passed about 20 of these in total, and he felt better and better and luckily started eating again. Most likely he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like little poop balloons in his stomach. This really is one of the weirdest stories I've ever heard. But my boyfriend's mom said he had been known for eating weird stuff, like this one time he ate a t-shirt. A colleague of mine saw an obese woman in the emergency room for flank pain. Workup included a computerized tomography that showed a frog skeleton just outside the ribs. A second physical exam revealed a necrotic frog carcass between some fat rolls with very irritated surrounding skin. When asked about it, the patient said she and her obese husband were too large to have sex in the usual fashion, so they would get in the pond behind the house whenever they wanted to have sex. Worked for the local medical examiners for a few years. Got a guy who died at home and wasn't found for a couple days. His cats had snacked in him, a bit not super uncommon, but still unnerving in concept. In his pockets, found a receipt for cat food. Not a doctor, but my brother and I were the first from my mum's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother, and a month or so later she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine, so a month before my brother's due date the doctor finally realized that there were two of us. This was in 1985. Ultrasounds weren't nearly as good as they are now. Don't use Reddit at 2 in the morning. I forgot I could edit my comment. I put some more information in another comment that got buried. Forgot to mention that I'm female. Another sort of rare occurrence, and I was born breech. My mom told me that the doctor had to pull me out because I wasn't coming out on my own. To add to my mom's luck, I was sucking my thumb and tore her quite a bit because the doctor didn't realize my elbow was sticking up. Luckily for her, though, my brother had already been born. My Sill's mother was pregnant, had a miscarriage. Not sure of what happened if she passed the fetus herself, but for weeks afterwards she kept insisting there was another baby. Had to go for endless mental health assessments, since everyone thought she was just having a bad go of grief. Turns out, she was still carrying another baby, her eldest child, born healthy and happy some months. Intensive care unit nurse here had to prep a patient with a rectal vaginal anastomosis, a connection between the vagina and rectum. Every time I would insert the enema into her rectum, all the shit water would come out of her vagina. I honestly don't know if this is my weirdest, but it's the first that comes to mind. Thank you for watching this video to the end. Write in the comments, have you heard of any strange medical cases? I suggest you also watch our other videos,